Good afternoon, everyone. My topic today is about pain management in pediatric circumcision surgery. And as we know, the circumcision is the most common performer surgical worldwide. And still yet, common misconception in some pediatric surgeons, they still consider in some infant and a newborn, they don't feel pain as adult in circumcision surgery. And while a lot of research and studies that shown clearly the infant and newborn is feeling pain as adults do. So this moment highlight a crucial questions, how we can improve pain management in pediatric circumcision surgery to provide efficient pain relief during the surgery while minimizing the side effect of pain like hypertension, arrhythmia, tachycardia. In our study, we explore three techniques: caudal block and dorsal penile nerve block and systemic opioid. So the caudal block and dorsal penile nerve block, there are regional techniques, plus systemic opioid is this intravenous injected opioid during the surgery. Dorsal penile block and caudal block are frequently used because they provide efficient pain relief with fewer side effects, while opioid is surgery used when a surgery is expected to go longer and if their patient has any contraindication to go to regional anesthesia, like regional infection or local infection, plus if had any anomalies in sacrum or anomalies in venous, plus any disorder in coagulation. There are three elements that affect the choice of anesthesia of pain management strategy in patient surgery. That's surgical approach and the patient characteristic plus duration of the surgery. We use in our study, which is this prospective randomized case control observation, with simple size of 90 male patient for evaluation to the use of caudal block, comparing with another method. For prospective analgesia, recruited over 4 months between May 23 and the last of August 23. This study was ethically approved by Research and Research Ethics Committee in Government Hospital. And this name Salmania Medical Complex and registered with Institute Review Board number, this one, and was also registered in clinicaltrial.gov and got a numeral clinical trial with this number. And for total 90 patients participated in this study, classified into 3 groups. Group A, caudal block, which is received bupivacaine, and this included 29 patients, and second group was represented general anesthesia with an opioid groups with total 33 patients, and group C with dorsal penile nerve block included 29 patients. This study aimed to compare the effectiveness of caudal block with other methods of postoperative pain release. For pain assessment, all patients were compared based on hemodynamic stability, pain score, level of sedation, and analgesia need inside PACU and intra-op. We used flak analgesia and this during observation in PACU. As we know, at the end of the surgery, all patients will be shifted to PACU and the pain score will be observed and evaluated by anesthesiologists who separate on this study. As the score were observed and recorded during the first 5 and 10, 20, 30 minutes and 60 minutes in PACU. All patients have data collection and a questionnaire consisting of 2 sections. The first section, demographic characteristic, including age and weight, and the second section consisting of face, leg activity, crying, possibility. An analgesia scale was used. As we know, this flak scale is a standard tool to measure pain severity in pre-verbal pediatric, those who cannot express in their pain verbally or accurately. Which pain severity is scored from 0 to 10, and 0 that's mean patient on analgesic, and 10 that patient complain of severe pain. Caudal block. Caudal block is regional anesthesia technique, which involves to injecting local anesthetic inside caudal epidural space. This accesses through sacral hiatus. Light, how I can get the light? Okay. Caudal block we can perform by using 3 techniques. First one, blind technique that we use in our study, and fluoroscopy plus ultrasound guided. In the blind technique, all patients after receive general anesthesia and position it laterally or ventrally, we have to finding the bone market for sacral triangle, equal sacral triangle. It is base, posterior, superior of spinous processes, and caudal summit with this corresponding for sacral hiatus. And we have to finding the sacral cornua, which is fundamental to make ensure to successful or for the caudal block. And the needle would be inserted between sacral cornua and needle oriented 90 degrees to the skin surface and advance it forward until the needle crossing the sacrococcygeal ligament and perceptible pop. Then we have redirect the needle around 30 degrees and advance it inside sacral canal until 2 to 3 millimeters, and this is based on child size and weight. Then, after verifying the spontaneous reflux of blood or cerebrospinal fluid, we have to inject the local anesthetic. So, caudal block is technique involves the injection of local anesthetic, bupivacaine, and dose between 0.75 to 1 milliliter per kg with 0.25 concentration into the caudal epidural space. It provides effective pain relief up to several hours, 6 to 7 hours after injection the local anesthetic, and working by blocking the transmission of pain signals from sacral nerve roots. And he's avoiding the needed of opioid, and that also permit to avoid the side effect of opioid like respiratory depression, nausea, vomiting. This technique is particularly advantageous for neonatal circumcision because its performance is easy to perform and have fewer side effects, and this is preferable for pediatric surgeon or for an anesthetist also to provide as analgesic to circumcision surgery. While dorsal penile block is working by inflating the local anesthetic around the root of the penis. As also we can do this blindly or using ultrasound. And dorsal penile block is using in children and adults for surgical procedure for the shaft of the gland and for the penis. And he offers immediate relief after injecting, working by acting directly of the surgical site. And he has localized effect, leads to faster recovery. This method is useful for early ambulation and discharge from recovery. And these techniques also permit to avoid the use of opioid during the surgery and in recovery room. The local anesthetic was used bupivacaine, 1 to 1.5 milliliter, maximum dose 2 millimeter, concentration 0.25% for infant. For infant, technique is different in adult. Is injected superficially and deeply along the lower border of the pubic ramus to anesthetize the dorsal nerve and to complete dorsal penile nerve block, and this is called ring block. Sometimes the local anesthetic diffusion of the anesthetic agent within the surrounding tissue, which may affect the sensory of motor function, and this may sometimes cause obstacles for awake children. Dorsal nerve penile block is terminal branch of pudendal nerve and sacral nerve roots from S2 to S4. For systemic opioids, systemic opioids are systemic narcotic agent administered intravenously to provide analgesia, and this acts by attaching on opioid receptor in the central nervous system, blocking pain signals effectively. Systemic opioid offer broader range of analgesia when supplemental pain relief as required. Potential side effect: respiratory depression, nausea, vomiting, and constipation, and micturition and pediatric. For static analysis, we use multi-program to have reliability and confident plus validity. And we have check analysis, this detecting the predictor of pain scale, and our tests were two-sided. And this accepted level of the significant in this work was P less than 0.05, and P value less than 0.01 was considered highly significantly, and P more than 0.05 was considered as non-significant. And here for table 1 is demographic data on children who underwent for circumcision surgery. And this value, it was significant between groups for age. And the very important, this CVOMAC, it was lower requirement in Caudal Block comparing to other groups, and it was this value. And fentanyl intraoperative and postoperative also, it was low requirement in Caudal Block comparing to other groups, and it was significantly less 0.01. And for heart rate, the heart rate, it was in systemic opioid lower, followed by Caudal Block groups and dorsal benign nerve block during 5, 10, and 20, and 30 minutes for postoperative. And this figure reflects pain scale among this study. We can see here the group, the Caudal Block patient, and this crying, not the crying, and here crying, but it was significant during the first 5 and 10 minutes. Then after this time 30, it was not significant. Behavioral scale. Caudal Block was here more calm and comfort comparison and other two groups, and it was significant from 5 and 10 and 20 and until 30 minutes, 60 minutes, no significant statistically. So study result showed that patients who underwent Caudal Block had significantly lower pain score compared to patients who received penile block, and p-value significant, less than 0.01. Caudal Block provide denser analgesia and prolonged compared to dorsal penile nerve block, making the children more comfortable and calm in PACU. Patients who received Caudal Block required fewer secure analgesic, has less nausea and vomiting, and experience fewer side effects compared to patients who received dorsal penile nerve block. And Caudal Block was noted to reduce the sevoflurane MAC consumption significantly in comparison with the other two groups, was significant in p-value. Fentanyl consumption intra and post-operative was higher in group B, followed by group C, while lowest level in consumption was among group A patients, that's mean Caudal Block. The crying score was less in Caudal Block compared to dorsal penile block during the first 5 to 10 minutes. Caudal Block has longer time in maturation versus dorsal penile block, and this disadvantage for caudal and advantage for dorsal penile nerve block. While dorsal penile nerve block is preferable for children who is aged above 3 years because this patient is walk, and the dorsal penile block avoid motor block, and this permitting to charge from recovery soon, and has less duration of analgesia compared to Caudal Block after 20 minutes, and this advantage for Caudal Block. So patients who received penile block had expressed a longer time to achieve the relaxed and comfortable state, but with no significant differences with the offered other two groups. So this the present prospective randomized case control study showed both Caudal Block and dorsal penile nerve block are effective techniques in providing analgesia in pediatric surgery and have less vomiting and nausea compared to opioids. And the Caudal Block was shown to provide higher level of analgesia and longer duration of pain relief. Parent satisfaction with fewer side effects and lower requirement to rescue analgesia compared to dorsal penile nerve block. So this reference to research done in government hospital This first one, this recently in 23, another one in 2022. The second one is also about caudal block with general anesthesia. And also this have shown that caudal block has reduced the requirement of general anesthesia during the surgery, intra-op and post-op. And both have published in international journal and registered in clinicaltrial.gov. And this our team, I don't, this photo not clear. For high post-pediatrics team, and this pediatric surgeon was anesthesia team, and this our OT, this our chairperson, Dr. Rosman, and this our colleague, our drugs machine, and we are invite you to Bahrain Bay. Welcome, of course.